give us a little background of what was important for you to express on the panel today in regards to concussions?
Absolutely. I came in really with two stated goals, which I got luckily a chance to reiterate during the panel twice. Number one was I really wanted to let people be aware of the fact that concussions happen to everybody. It doesn't matter what sport. It's not an issue that is confined to football. It's not confined to soccer or hockey. It really goes through every single level of play and every single sport. And I have seen patients who have suffered concussions in a variety of situations in just about every sport that you can think of. And I wanted people to be aware of that. And not only is it just a sports-related issue, but of course, concussions are an issue in the general population. People don't just get concussions when they are participating in an athletic activity. They can fall and hit their head at any point during the day. And everybody needs to be managed appropriately. And the second part that I really wanted to people to take away from the talk today was that every single case is individual. And while there are a set of guidelines that we use in order to dictate treatment and to make decisions, every single case needs to be handled individually, and you can't expect every person to recover or be treated to recover at the same rate or be treated the same way.
Yeah, and as you said, every case is different, and a lot of the protocols in certain leagues or at certain levels is, oh, you have concussion, you have 1 week off, 2 weeks off, 1 month off. Can you talk about some of the guidelines and tests that you guys use that could better determine on a case-by-case basis how much time an individual needs?
Absolutely. One of the main, or really the main treatment protocol after a concussion in sports is rest. And the duration of rest, again, varies by individual. So typically, I will take an athlete, and if they are in school, I will excuse them for school for at least a week, prescribe a course of physical and cognitive rest, which means no sports, no running, no jumping, no bicycling, no swimming, no nothing, just very low levels of activity. Cognitive rest, which is no texting, no cell phones, no TV, no computer, no video games, like nothing, as little as humanly possible. And then the thing is about that is that it doesn't mean that after 1 week that it's going to be better. It means that we'll reassess after a week. And I always tell my patients that they can call me at any time. So if they're feeling better within a matter of days, well, that's fantastic. And we can maybe get them in a little bit sooner, re-examine them, and try to determine if we can accelerate their return to play process. But if they come in after a week and they're still symptomatic, it may mean that they need more rest. It may mean that there are some other issues that we have to treat, whether it's a headache disorder or other injury that's related to the injury that caused the concussion itself, if it's a shoulder or a neck issue that's contributing to some symptoms. So it's a very dynamic process, and it's not just a blind prescription of, hey, you rest for 1 week or you rest for 2 weeks. It's a very dynamic process that changes based upon the rate of recovery for each individual. And then I think you also asked about what other tools we use. And of course, we do use, when they're available, the baseline neuropsychological testing, such as IMPACT, which is a computer-based test of thinking, memory, and reaction time. The way that it's best utilized is if an athlete has a baseline level, meaning before the season, before the sport starts, they get tested. And then if they are injured during the course of the year, we can retest them and we can examine their post-injury scores to their baseline scores. If we see that their scores have not returned to their baseline levels, that is a sign that they may not be recovered. Again, it's not the end-all be-all. Certainly, if their neuropsychological scores have returned to their baseline levels, but they're still having symptoms, or you as a clinician still have reservations about their return, then they wouldn't be cleared to return to play. But if they're asymptomatic, they've recovered well, they've gone through a return to play protocol, and their baseline tests are normal, that is a patient that you would certainly highly consider for return to play.
Thank one of the things you talked about is resources, and obviously in professional sports, where baseline testing has probably become pretty much of a staple in concussion prevention and treatment. It's easy because they have, to some of us, unlimited resources.
Right.
But the problem is that some of the, whether you're talking about school or you're just talking about community leagues, they have limited resources. Can you just talk a little bit about what programs are maybe more efficient as far as monetary policies, and maybe, you know, where do you see it going in the long run?
Yeah. So for those districts or leagues or whatever it may be that does not have the resources for this type of testing, because it certainly costs money, then there are other things that we can use. So certainly I'm going to rely more heavily on my patient interview, which is a vital and integral part of the decision-making process, whether there's baseline testing or whether there's not. But a very, very thorough and comprehensive interview discussing symptoms and their time frame of recovery. Because as I said, we certainly want to make sure that somebody is asymptomatic, no more symptoms before they go back. And of course, there is the physical exam, which involves a neurological examination. And I'm going to be testing their coordination, their balance, their eye movements, their strength and their sensation. I'm going to be also testing their cognition, their thinking. So there's a variety of bedside, meaning, you know, in the office types of tests that, you know, questions I can ask my patients to try to assess how well they're thinking. In addition to that, there are some tests that don't cost a lot of money that can be utilized. Some of these tests include something called a Montreal Cognitive Assessment, which is a paper and pencil test that is a test of thinking and cognition. It can be scored and it can be re-administered in multiple versions, so you can track someone's process or track someone's progress through recovery. And another very important part of the information often comes from family and caregivers, because you want to ask them, how is this patient behaving? Do they seem the same to you, or do they seem a little bit different? Have you noticed anything that would be a sign or a clue that maybe they are experiencing some symptoms that either they're not aware of, or in worst case scenario, sometimes patients are deliberately hiding from you. So those are the types of things that take into account if you don't have baseline testing available. In some cases, if there are cases who are extremely slow to respond, if they are taking several weeks to months and there is uncertainty as far as why are they taking that long to respond and recover and get back to their baseline, that may be an instance in which we utilize formal neuropsychological testing, which is not the brief battery that the computer-based testing is, but rather several hours worth of testing that is administered by a trained clinical neuropsychologist. That type of testing gives a great snapshot of patients' cognition and thinking, but also is very sensitive at detecting other issues that may be affecting their rate of return and recovery. And when I say other issues, I mean mood issues and psychosocial stressors that sometimes can influence recovery.
I just actually have one more question that I should ask in the beginning, but if you don't mind, just kind of give your background and credentials.
Sure.
Of how you have this knowledge.
Sure. So I'm a physician. I did my medical school at Temple University School of Medicine in Philadelphia, and then I went on to do residency in a field of medicine called physical medicine and rehabilitation. It's a field in which we are experts in diseases of bones, muscles, nerves, and brain. Among our various areas of specialty includes working in rehabilitation hospitals with patients who have a variety of injuries, from orthopedic injuries to strokes and brain injuries and spinal cord injuries. After completing that residency, I went on to do a fellowship in neurological rehabilitation, focusing on stroke and brain injury rehab at Washington University in St. Louis. And I am board certified in physical medicine and rehabilitation. And I work full-time at the Drucker Brain Injury Center and Moss Rehabilitation Hospital in Elkins Park, Pennsylvania.